Hi, Wally Taylor from Forum Health Partners, Texas Integrative Medicine in Austin, Texas, and just wanted to get out a very short video with what I think is some important information. Earlier this morning, I was watching an instructional video which was being put on by Scott Forsgren, the Better Health guy. He was interviewing Dr. Ann Corsin, who is a physician treating chronic complex illness back east. And the topic of their discussion was hypercoagulable disorders. And I wanted to spend just a few minutes talking about this because I think, especially now with the pandemic that we're experiencing, and some other things that I've read, even there was an article that I shared on my Facebook page, Wally Taylor MD, Texas Integrative Medicine, about the effects of the virus on blood clotting. But I think it's very important information, so I wanted to get it out. You know, the thing about blood coagulation is it's a very complex system that we have in our bodies with lots of checks and balances. And, you know, the issue boils down to the fact that we have blood that circulates in our arteries and veins. And from time to time, there can be little cuts or injuries to our vessels that can allow for the blood to leak out. So what the body has developed, of course, is a very complicated system that allows the blood to clot, or to basically close off these little leaks when they occur. But it's also a very delicate system that is very important that clots not form when they're not needed. And unfortunately, one of the big ways that the process goes wrong is that the blood becomes hypercoagulable. Some people might say too thick, but basically it does form a tendency to form sludges and clots when it shouldn't. And of course, one of the big things that we've been finding now is that virus infection can be a particular triggering cause of this. And so we are seeing a lot of cases now with the pandemic where there appears to be clots in multiple organs in people that have had problems with the virus. So the problem boils down to the fact that we have this system in the body called the fibrin system. And our body makes a protein called fibrinogen, which when it's activated or split off to form fibrin, the fibrin then has a capacity on exposure to another group of proteins called the thrombins for the fibrin to form sludge and later actually to form clots. Well, the problem is that this soluble fibrin, which has been activated, also tends to form a glue-like sludge in other parts of the body. It can even form this along the linings of our blood vessels, particularly the small blood vessels like the tiny capillaries. And one thing that Dr. Corsin points out is that when there's even 1 micron, which is a millionth of a meter of fibrin on the inside lining of a blood vessel, and basically, just to give you an idea, a red blood cell is 7 microns wide or in diameter. So a seventh the size of a red blood cell. Very thin little coating of this fibrin sludge. And you can think of it almost like a glue, that it actually cuts down the ability of oxygen to travel from our red blood cells in the capillaries across the wall of the capillary into the tissues where our cells are. Like, for example, our heart cells or our brain cells or our hormone cells or our immune cells, kidney cells. It can actually drop down by 500 times the amount of oxygen that does not cross when there's this very thin layer of fibrin. So this is a big deal. Now you might say, well, the other thing that plays a big role there is our platelets. So platelets are these little tiny, they're not even true cells, but they come from bigger cells called megakaryocytes, and they actually circulate in our blood, and they stick together forming platelet aggregates or even platelet plugs. And this is one of the ways that we block off when we have a cut in a blood vessel. But unfortunately, platelet plugs also play a big role in the formation of heart attacks and strokes if they clog up our major blood vessels in a place like the heart or the brain. So you might say, well, what kind of symptoms could you expect from when this blood becomes too thick or what we call hypercoagulable? Well, it turns out that one of the things that you can see is that the oxygen being delivered to the peripheral tissues is lower than it should be. So one good, easy way to potentially check for that is with a pulse oximeter, a little inexpensive device that you can put on your finger, and it measures the oxygen going to the capillaries of your finger. So that's one way. There's many ways, but it turns out that just some of the symptoms associated with having this hypercoagulable state would include having cold hands and cold feet, having unexplained swelling of your hands, feet, ankles, persistent fatigue, numbness and tingling of the little nerves, shortness of breath, brain fog, and a mottled appearance to the skin, which some people would call livido reticularis. These are actually some ways that we can tell when we may be in a state of hypercoagulability. Now, we've known for a long time that some people are at risk for clots, and there are medications that can be prescribed, like, for example, heparin can be injected, or some of the newer drugs, like, for example, Lovenox, Xarelto, and there's quite a few new ones. But it turns out that there's also some other things we can do that are more natural that can prevent the tendency to form clots and help with the over buildup of this fibrin, soluble fibrin, this glue-like material that can form inside of our blood vessels and even out in our tissues, what we call the extracellular matrix, which is the space between the cells of our bodies, like in our muscles and in our tissues. So one of the things that is very valuable that can be used if we're in this state of hypercoagulability, and that's the use of proteolytic enzymes, or enzymes that can actually break down the soluble fibrin. And there's any number of them that are very useful. One of them is called lumbrokinase, which is actually derived from earthworms. Another one is called nattokinase, which comes from the natto bean. There's serrapeptase, which comes from silkworms. And there's other forms of proteases. These are actually very similar enzymes to the ones that you might use to assist digestion of foods. But when these enzymes are swallowed or taken away from food, separated by 30 minutes, even an hour or 2 hours, taken on an empty stomach, these enzymes tend to be absorbed and get into our tissues where they can circulate in our blood and lymphatics, and even in some cases find their way into our extracellular fluid matrix, where they can actually digest down and dissolve out some of the soluble fibrins. There's any number of really good over-the-counter enzyme products that are available. Now you might say, well, how could it be tested for? It turns out that there's a number of tests. Some of them are fairly common and conventional, other ones not so much. You can actually even start by doing a free bleeding time, which is actually where they make a little tiny cut on your skin and just measure how many minutes it takes for the bleeding to stop. You can also measure the olden PT and PTT and INR, which are some of the measures of blood clotting that are checked when a person, say, for example, is on a blood thinner, like Coumadin or heparin. Now, it turns out that there's a lot of other ones, because there's a lot of other measures that can be taken. You can measure the thrombin. You can measure one called thrombin antithrombin complexes. There's some specific proteins like protein S and protein C. One of the ones that you can measure for is the D-dimer, which actually measures for fibrin breakdown products. So if there's fibrinogen is being converted excessively to fibrin, and then the fibrin is being broken down to fibrin split products, or one of them is known as D-dimer, which can be measured for. So these are just a few ways that we can assess for hypercoagulability and even treat it. Now, it turns out there's also some genetic issues. People can be born with a significant increased tendency to have problems with clotting. So in some cases, it's because the fibrinogen is not produced properly, or it's not broken down properly. Sometimes there can also be congenital issues with the platelets themselves. Well, anyway, COVID-19 seems to be playing a big role here. The presence of this particular virus seems to be playing a triggering role in terms of some of these abnormalities of the way our blood coagulation system is working. Now, these haven't all been worked out yet, and there's still a lot of research that needs to be done. I should also say that there's many other environmental toxins that appear to play a triggering role in causing these problems of coagulation, including other infections, like, for example, the Lyme disease, many other viruses, chronic herpes virus, Epstein-Barr virus, Babesia, which is relative to malaria, Bartonella, and probably electromagnetic frequencies can play a role, probably many toxins, including one that Dr. Corsin talked about quite a little bit in her lecture on the Better Health Guy that I just watched, and that would be the toxin glyphosate, or Roundup, which unfortunately is in the air, food, and water everywhere, and seems to be playing a big role in terms of our ability to have normal coagulation, normal blood clotting. Well, anyway, if you're interested to know more, I'm available. You could call Forum Health. I'd be happy to arrange a consultation. Another really good resource would be to view the lecture on the Better Health Guy from Dr. Ann Corsin that Scott Forsgren did, and I'll be sure and put that in the show notes. And anyway, I hope this is helpful, and everybody stay safe, and we'll be trying to send you out some additional information soon.